Okay, great. Well, thanks everybody for joining today. We have an exciting program planned today. We're here today with Tungsten Medical Network, and we are going to be chatting a little bit about our relationship working with them, and also about how you can set yourself apart in an industry by providing things like great customer service. And so. I'd love to just get things moving forward. A couple housekeeping items we have first. If you're in attendance on the call today, your microphone will be muted, but you do have the opportunity to add any questions that you'd like by typing them in the chat. You'll see that Q&A session, and we'll see those questions pop up, and we'll try to respond to as many of them as we can during the call, and also happy to respond after the call if we need. So without further ado, today's topic, customer service so good that it impacts your bottom line. So, and we truly believe that here, both at Purview, and I know over at Tungsten, they believe that as well. We've worked together for a number of years now. We'll get into that in a little bit, and we've seen it firsthand with how seriously they take that at Tungsten. So exciting to have this event going on today, and to be able to introduce Mike and Tungsten here. So without further ado, if you're an ENT specialist, you probably heard of Tungsten Medical Network, and if you haven't, you probably should. Tungsten's a leading supplier of in-office CT scanners, endoscopy, and microscopy equipment focused entirely on the ENT market. Mike Luick, who we have here today, is business manager at Tungsten and has a proven history of success in growing businesses, partnerships, and operations management in the medical device space. So thanks for joining us, Mike, today. And please feel free to fill in any details I missed there as far as background of yourself and Tungsten, and then we
That was
can
good, Josh.
keep things
Thank
going
you.
from
Hi.
there, right?
It's good to be here. I'm glad we're doing this. We have been in a partnership with Purview for it's going on 8 years now. So I
Wow.
think it's safe to say we know each other pretty well.
Yeah, and I think it's been really cool to see how your organization has grown and scaled over that time. I mean, we see, every month you're adding new facilities, expanding your reach, and it's really been a powerful relationship. We've obviously been very thankful for the partnership over the years. So thank you
Likewise.
first,
Thank you.
and then we can kick in. But yeah, and we've been through a lot together, right? 2018, that's pre-pandemic. So we we had some storms we've had to weather during those
A lot
years.
has happened, yeah, in the last 8 years. It's been a fun ride to say the least.
Yeah, absolutely. Great. So bet some people are wondering, where's your name come from? So Tungsten, it's a specific name. So tell me a little bit about that.
Yeah, well, let's start with kind of the basics of cone beam CT, because that is where tungsten comes from. There are a handful of different cone beam CT scanners on the market, and they all are a little different in the user interface, which buttons you have to press to acquire a scan, how the computer reconstructs the image or the software. But they also have a commonality in that they all share the same basic technology for how they work. So they all have this C-arm, or I call it the gantry, that moves around the patient's head, and it has two main components, and they stay opposite of each other at all times as it pans around the patient's head. So on one side, you've got the tube, and on the other side, you've got the detector panel. When the tube is energized, it emits a cone-shaped X-ray. So that's where cone beam CT comes from. So it sends this X-ray through the patient's anatomy, it hits the detector panel, and then the detector panel sends those images to the computer, and the computer reconstructs that into a 3D image, and then ta-da, you have a CT scan. That tube, on the inside of the tube, it's kind of like a light bulb. It,
Mhm.
it, it has a filament in there. It's a cathode filament that's made from tungsten. So quite
Ah,
literally, your CT scanner would not work without tungsten. So we named our business Tungsten Medical Network, or Tungsten for short, to pay homage to the science that's behind CT.
well, that's great. I'm learning something today as well. I can't say I knew that one before, so that's great. Thank you for that. Yeah. So with that in mind, I'm curious as well. How do you set yourself apart in this market? And I know we said you focus mainly on ENT. How did we come to that focus, and just how do you set yourself apart in an industry where I'm sure there are others out there, but what makes Tungsten special?
I would say there are two things that really separate us. And the first is that we service all brands of CT scanners. So whether you have a J Merita, a Zoran, a Carestream, we can service that scanner. And the second is our responsiveness. We are passionate about customer service. And let's be honest, we've all been in a position where we need customer service at some time or another. And when you need it, time passes differently. You're a little bit impatient, and it's important to us that we get back to our customers immediately. That's the secret sauce, is that we respond within seconds, sometimes minutes, if it needs to be. But we kind of have a race at our company. So when a issue comes in, we announce it, and it's a race to see who can respond first. And we kind of give each other sort of jokingly, we'll say if someone responds within 5 or 10 seconds, we'll say, "What took you so long?"
Oh, that's great. I think, one of the great things to note is when you instill that, culture of customer service, it kind of permeates through your entire business. And like you're saying, everybody's on board, everybody's looking for that. We try to do that here at Purview as well. And we say something becomes important when you track it, right? And so we track different metrics and different things to be proxies for customer service, like no calls go to voicemail. Because I think in
Yeah, I
this,
love
so
that.
every month we're tracking, did any call go to voicemail? And if it did, why? And the reason is because, in today's world, you want to get to a human, especially in this new world of AI. And I mean, we were talking before about, you try to get through to your insurance company, or one of those companies these days.
Yeah, or the
Try to
airline phone
find a
company.
person. I had a recent experience where I probably was on hold for 20 minutes, just and then following all the different prompts. I mean, it's a headache no one wants to deal with. So, how do you guys handle that? It sounds like the message is there. Someone calls you, you're going to get to a person.
So there's really several different ways that our customer can get a hold of us. And the way I say it is, whatever your favorite form of communication is, that's how you can get a hold of us. So with a lot of our customers, it's texting. So we can get a quick text message, and that's a quick solve. Of course, email, phone call, and FaceTime as well. If we need to do a Teams video chat, uh, we won't take anything off the table. So however our customer would like to communicate with us, that's how we'll communicate back to them.
Right. Yeah. No, I think that's great. And I think it's almost a lost art today, right? It's almost a lost art that getting through to a human, having customer service be first. But
I totally agree. When you have a patient in the chair, for example, and you're trying to take a scan, 20 minutes is an hour. 20 minutes just feels way, way too long. So it's important that we answer that call immediately. We have the ability to remote into the computer from our computers. We can actually even do it from our phones, which is pretty neat. So in a pinch, if we need to solve an issue, we can remote in and get it fixed quickly. That's the name of the game.
yeah, and I'm assuming those are real examples, right?
Oh,
Patient needs help
absolutely.
right there. You're jumping on it quick. Um,
Absolutely.
yeah, any of those stories that pop to mind, anything that you've had one from experience, or you've had to navigate something like that.
Yeah, there's probably a few. We've got a few hundred customers across the country, but one that comes to mind is usually the one that happened most recently, right? Is we had a customer with a computer monitor that they must have had for the last 9, 10 years, something like that. And one day the computer monitor just doesn't turn on anymore. So they call us, the monitor's not turning on. Okay. So we go to Best Buy, we buy another monitor, DoorDash it over to their place, and we have a new monitor set up within 45 minutes of the call. So we were happy about that. And we're communicating on our Teams chat. This is done. Cool. And about maybe an hour later, maybe we get a text message from the same customer, and it's a photo of this brand new monitor that is it's broken. It's totally cracked. I don't know what happened, but somehow someone bumped it. Maybe it was larger. I don't know what happened, but it was definitely ruined. And we were like, you've got to be kidding me. The last monitor lasted 10 years. This one lasted an hour. So what did we do? We went to Best Buy, buy another monitor, ship one over, and it's done in 45 minutes. We don't need to nickel and dime the customer. Maybe if it happened 3 times, we might have 4 times, something crazy, but we just solve the problem, get it done. And of course, how happy was that customer with us? They were very happy. We got a Google review for it, so that's really important to us, and that makes it worth it right there.
Yeah, absolutely, absolutely. So no, that's a great story. I love that. And
So
and
it happens. This is the
and
real
and
world.
and I think you're right, right? You do what it takes to get it done. You get the customer back up because you're in this for the long haul, right? You're not in for a quick dime. You're in it to build a relationship with an ongoing
Absolutely.
customer. And you guys are really partners in this with your clients, right? I mean, you speak to that
Absolutely.
a little bit.
Yeah. So you were mentioning this, that we've all been there where we need an answer. And if you're calling customer service and need to speak to a human, I would say, look, I love technology, and we are a tech company. We have the high tech solutions, but Tungsten is going to bridge that gap between technology and the human element.
Mhm.
And sure, you mentioned AI, and AI is cool, but I don't know if it'll ever have it, but it certainly doesn't have this now, is AI doesn't have empathy. And when we get a call, we know what it's like when it doesn't even matter if it's human error or something is wrong with the computer or whatever. It doesn't matter. We have a problem. We need to get it fixed. We need to get it fixed now. So that's what we do, and our customers love us for it. Here's an example that I think a lot of people can relate to. Uh, Certainly in a previous life, I'll say, if you've ever had a customer, someone that was, or a patient, someone that was paying you for a service, and they were upset with you for whatever reason, what's life like? Uh, Life sucks when your
Yeah.
customers are upset. It's not fun. And I want to live a good life. I think everybody does, and we certainly do at Tungsten. So to the extent we can just take care of our customers so they're happy and that they love us, we live good lives. And so our lives are better when our customers are happy. And that's what we strive to do every day.
Yeah, absolutely. And I think, for us at Purview, and I'm sure for you as Tungsten as well, we're supporting a lot of organizations that are there in the field, that are working with patients, that are making a difference in the world, honestly, right? We talked about the pandemic. I mean, everybody having to pull together through that time period. But just in general, on a day-to-day basis, customers are out there trying to make people's lives better by improving medical outcomes. And if we can be there as support on the backside, the technology, the scanners, the cloud systems, all those things are support of the patient relationship at the end of the day. And a customer who has good relationships with their vendors is going to have better relationships with their customers. Try to all those patients at the end of the day get better care, right?
Totally agree. And look, there's a lot that goes into in-office CT, more than just the scan and acquiring an image. Before you even get the scanner, will it fit in the room? Does the room need additional leaded shielding? Who can push the button? That answer changes from state to state, by the way.
Yeah.
There's shielding requirements. And then once you get the scanner, there's an annual physicist survey that needs to happen, an annual preventative maintenance. There are dosimeter badges. There's regulatory paperwork. There's accreditation. I mean, it's a lot.
Yeah.
And I promise, because we've made a business around it. And so our goal is to just be a one-stop shop for our customers, to make ownership of in-office CT as easy as possible. So we want to be the one call to compare and contrast the different scanners on the market that are available. There's going to be pros and cons to all of them. We can talk about that. Let's talk about price, how that is going to impact the decision. How many scans are they doing a month? Are they imaging only the pardon me, only the sinuses, or are they doing the temporal bone as well? And with that, we take a consultative approach to then recommend a scanner that is best for the physician and their practice and their patients.
Yeah. So to piggyback on a little bit of what you said in there, then so was the desire to provide a complete solution for ENT practices, to drive bind including technology and these services and things in your practice? And is that kind of where your head was at as you put that all together?
Yes, definitely. We saw a gap in the marketplace where we didn't see any one company that was handling all the things that were social, all those things I just mentioned. That we didn't see a one company that was doing all of those things. Often we saw these potential customers for us were having to do a lot on their own, scheduling through third parties and whatnot. And we wanted to be that one solution that encompassed all the things with in-office CT.
Wow. So, and I think that's probably where our relationship kind of started to build those years ago, and since we've and since then. So I guess when you were in that process, were you comparing other platforms for some of the services Purview provides, or how did that come about? A
Yeah.
little bit of background into where our relationship came from.
Sure. So another part of this solution is there's software that is associated with ownership of in-office CT, and we would have a lot of our clients come to us, and I would say probably most of our clients would already have some kind of PACS software, but most didn't like it. The chief complaint among them would be that their existing PACS software was too slow, and I would say they also wouldn't know what they didn't know. And what I mean by that is there are some features that Purview offers that they didn't even know existed. And so I love showing this. So one of my I'll show you on my phone right now, if I may, is so I've got Purview on my phone, and this is we've got our study browser. And just to like show briefly how quickly it works, I can click View on Web Viewer, and I've got the CT scan already up. I can change the views, I can zoom in, I can change window level, take measurements. I mean, I can share scans right from my phone, and it just works. It's just fast and convenient. Of course, on my phone works in a pinch. It works even better on a little bit bigger screen like an iPad or a laptop. And actually, if I may, I'm going to share my screen and
Oh,
show you
wait. Yes.
like the full featured viewer. So of course, have this set up where we've got our study browser. You'd see patient names on the left. I want to go through some of my favorite features with Purview. If you click this eyeball, you would open up the scan and be able to see your different views. You can change the view layout. If you double click, you can just focus on one or the other. You can change window level. You can change the sharpness. You can change white to black. And if you ever get to like, it's just, you've done too many changes and you're like, oh, what do I do? I just need to go back. You just click one button and it goes back. It's just easy to use. It's intuitive. All of these buttons here, if you just long press or long hold, excuse me, over the button, it'll tell you what it's about to do. Neat viewer, easy, intuitive, fast. But some of this is actually it is my favorite feature, is the share feature. So many times I hear about burning a CD for a patient. We don't have to do that anymore. You can click the share button. You can choose if you want to send it securely or not. It means if the patient on the other end needs to enter their date of birth and last name, if you want the ability for them to download images, if you want the link to expire, and you just enter in their email right here and it's done. Or if you want to use your own email client, you can copy this link, and then what it would look like on the other side is just like this. So the patient, or you could send this to another physician, no special software for them to download. They click view images, and this is all in real time. This is how fast it loads. You're ready to scroll through the scans, or excuse me, scroll through the slices, and it just it just works. Another feature of mine that I quite like is the remote download. So often where the modality is at one location and say a surgery is happening at a secondary location, you need to physically take a CD or a USB from point A to point B. And this circumvents that. So you can download remotely and then put it on a USB or CD from point B and take it into your IGS or navigation system. I mean, there's so much. There's reporting features that you can write. We can customize this template. You can have your own logo on there. There's just a lot that it does, and it's just I've said this, but I mean it. It's easy to use. And when I show our prospects Purview and they compare it to what they've been using in the past, it's usually a very easy decision.
Yeah, well, we appreciate the kind words and also the feedback you guys have provided over the years. I think part of customer service and being being attuned to that is also listening to your customers for what's needed. What does the system do? They're the ones that are out there every day in the field using the system, and so we really try to listen to that kind of feedback. Any examples, any thoughts of things you've seen in the years that have kind of helped improve the product?
Well, yeah, my example is of course with you guys when we have sent feedback. You've actually you did listen and implemented the feature. So I could share what being able to edit DICOM. So we all live in the real world. Sometimes you make a mistake on the entering the patient
Right.
name, something like that. And now it's just quick of a button. You can edit patient name, date of birth, MRN number, whatever you need to edit. The ability to delete studies. Sometimes you push a study and didn't mean to for whatever reason. Just little things like that have saved everyone a ton of time. And yeah, we really appreciate it. I think that's why you guys have been such a great partner for us. Is your customer service is on point. I appreciate you taking our feedback and not just saying, yeah, okay, we'll get around to it. You actually implemented it. So thank you. It is appreciated.
Yeah, no, I think, we try to put our money where our mouth is on that. We have systems internally where our support desk is able to hear those things from the customers. Anybody in the company has the ability to open a development feature request. And if they open it with the support of a customer, that obviously carries a lot more weight as well. And then we review those things on a weekly basis. We're reviewing product and feature requests, and then we plan that out in roadmap. We look at them and we weigh them compared to because we have to play a little bit of a gatekeeper. If somebody's asking for something that's very uber specific, is that going to make sense? But for the most part, when you get a lot of this great feedback, you're able to look and see how can we make the product better. And then we source opinions as well. We'll get feedback, but then go talk to other customers proactively and ask, is this something that would be valuable to you as well? And we learn the more we iterate and the more we go. Um,
Nice. Yeah,
it was interesting. I was, something you brought up there with CDs. I still find it funny that there's so many practices that will still burn CDs, right?
I
And
agree.
I'm looking at my computer right now. I no longer even have a CD drive in it. And where would I even put
Same.
one? Unless you're buying an external CD drive, you can't do anything with that today. So that's where I think, the ability to share that study, whether it's with the patient or another physician, it goes a long way. Do you see that as well?
Definitely. And I mean, another feature is the DICOM push.
Mhm.
Purview has its own DICOM push, and almost all the time we can configure a DICOM push from the modality. There's a couple things that come into play, but provided that the image guided navigation system is on the same network, we can, with a click of a button, no CD, no thumb drive. I actually just set this up yesterday for a client in Raleigh, where you just push the button now and it just appears in the navigation system like a magic trick. It's pretty neat.
So talk me through another one. One of the things that, we're obviously a company like everybody else. We have vendors that we use for software as well. And, to me, one of the most painful processes is the onboarding process. We get a new software, or we decide to, set up a new accounting system or something like that. And you have the joy of onboarding a new platform. What's it like? Both from the scanner side of things, take me through that process. So say somebody's interested in
Yeah.
bringing in tungsten, both from a scanner as well as a software standpoint. What's that look like? What's an expected kind of process look like for you?
Well, from the onboarding standpoint, let's say we've gotten past all these different scanners and we've finally got it installed. They've got their new toy is here and they want to learn how to use it. I love that part. That's one of my favorite things that I do is in office, in person training. To get buy-in from your customer sometimes can be difficult, especially when it's different. We're all creatures of habit, so if they're used to a different system or a different workflow, now this one's just a little different. And people learn in different ways. And so we've adapted to that. So I definitely feel that in-person training is the best. People can learn either from you telling them about it, you showing them, or them doing it themselves. And we like to do a combination of all three of those things. But understanding that people like to learn differently is we have what we call quick reference guides that we have laminated. So if you want to see like a physical guide in front of you, sometimes I call it a choose your own adventure, in that if you're trying to scan the sinuses, you could do this. If you're trying to scan a temporal bone, do this. Unilateral, go over here. And so it tells you step by step exactly what to do. Other people, if you want to learn asynchronous training, we'll send you a YouTube video. We have YouTube videos on how to take scans, how to burn CDs, like the most popular things that people ask us. We have YouTube videos on how to do that as well. And then we're available. So you call us, we'll remote in, and we can either watch someone do it, or we can show them, literally drag the mouse and, okay, you click here and go to this folder, whatever it is that we're showing them how to do. And we don't leave until everyone that we have trained on operating the scanner is confident in doing so. And I take it personally. I take it seriously. At the end of the day, there are these patients that are sitting in this scanner are sitting there not because they can breathe perfectly. It's usually the opposite. They're having headaches, breathing issues, sleeping issues. Something is going on, and they need a scan to figure out what is actually happening. And then we're emitting radiation to them. So it's important that we do it right. We do it right the first time. We get crystal clear images so we can figure out exactly what's happening with this patient. And I gotta say, to the extent that I can, I try to make training fun. Like, yeah, we're learning how to operate a CT scanner. It's not going to be boring. I do have kind of a funny story. I was thinking about this yesterday. I don't know why it just popped in my head because this was over a year ago. But we're on site, and I'm telling the everyone there that we're going to be doing training on. I think it was Friday. It was Friday at the end of the day, and I could tell they were like, "Oh yeah, we're okay. We're doing training." And I said, "No, it's going to be great. We're going to have margaritas. It's going to be fun." And they're like, "Oh, really? Yeah." And then it was a joke, of course. Like, I wasn't serious. But the next day, they're like, "Hey, so margaritas tomorrow, right?" And I'm like, "Yeah, okay." And then the next day, margaritas is happening. I'm like, yeah, okay. I'm like, I need to do something that is in line with this. So I went to Total Wine, and they had these margarita flavored popsicles, like with the tiniest amount of alcohol in it. It was Friday, end of the day anyway. And so, yeah, I mean, we're not gonna have margaritas, but we did have margarita popsicles at the end of training, and that was like that made it, and that kind of helped me save face. So yeah, to the extent we can make training fun on how to operate a CT scanner, we're gonna do it.
That's great. It reminds me of something we say here. So we say, remember your ABCDs, which are always be collecting dots. And a dot is a piece of information that you can connect with a customer. And so any of those little dots become things that you can help build a relationship about. So in your case, they're saying, hey, these margaritas, something we're interested in. We've had times where, on a call, we find out that, someone's gonna have a baby in a couple months, and we've sent them a Purview onesie, things like that, where,
That's
we
awesome.
know, just a little bits, we find out, who's their favorite sports team, and that human connection becomes so important, because then, that team makes it to the World Series, or, makes the Super Bowl. We're reaching out and we're saying, hey, and cheering with them. And it's gone beyond that too. I mean, recently we've had a lot of hurricanes and things happen in Florida. And we reach out to our customers
Yep.
proactively and just check in on them. How you doing? And so it can be, it can be geography, can be interests, can be any of those things, but it's connection points. And I think that goes a long way in customer support as well, and in building those relationships. So I'd say ABCDs,
Like that.
and you can build and grow those relationships as a result.
Yeah, that's cool.
Great. So yeah, any other benefits or things you'd like to share about things, services, things that Tungsten offers? I mean, I'm curious, for instance, if I'm out there today and I've got a scanner, I might not even know what I don't know about what's offered today in the new devices. I think about this, we unfortunately our car died recently. We had to go through the process of getting a new used car. And the amount of features and things that are in this car since the last time I bought a car, even 5, 6 years ago, it's amazing the technology, how far it improves and advances. So if I'm sitting there, what's my number one? What's my decision point for when I should be thinking about a new scanner? And what are some of these new things? You talked cone beam a little bit before, but what are some of these things that maybe these scanners have that would be different than where they were 10, 15 years ago?
Some of the biggest differences that are going to separate one scanner from another is the user interface. How easy is it to take the scan, to view the scan, articulate it in a certain way? And then, of course, is reconstruction. So I was mentioning that they have the basic technology, but that reconstruction plays a very important role on how clear the image result is. So to answer your question, we just ask a lot of questions about scan volume, price point or budget, what they're scanning, sinuses, temporal bone, when they're interested, if they don't have a scanner now, when they might be interested in getting one, if they already have a room picked out for the scanner, and if they don't, we'll help them pick out a room that would be best for the workflow and perhaps avoid additional leaded shielding. I guess I'd say this to say, and I've said this, there's a lot that goes into in-office CT, and to the extent that our customer wants to know it, great. We'll let them, ask me a question. I'll tell you all of the things so you can make an informed decision. But at the same time, or the other side of that coin is we want to know, we know all this stuff, so our customers don't have to know it unless they really want to. And if you want to know all the regulatory stuff, I'll tell you about it, but you might not want to. And so we do that to give our customers back their time. So the nurses and PAs and MAs and physicians of the world can focus on what really matters, which is providing healthcare to the patient. And so when they need a CT, it should just work and just get it done. Take the CT. They don't, it's like your HVAC in your house. You don't want to really think about it. You just want to press a button. And if you're too hot, you want it colder. You just want it to work. Same with CT. So that's what we do is at the end of the day, make sure that this stuff is easy to use and that our customers aren't wasting unnecessary time in trying to figure it out.
Great, great. Well, at this point, I'd like to open it up we've got some questions that have been written in. If there are other questions out there from the audience, please share them. But we've got one here, I think as you were talking about that, Mike, it's interesting. But there's questions around where do you see future developments in ENT technology going? Is there anything you can point your finger at and either say, I'm seeing, because you guys touch a lot of different organizations. I mean, you're out there, like you said, in the hundreds of locations. So where are you seeing this go in the future? So I'd add to it, where do you hope it goes?
Sure. I think future is going to be in some automation. So I think AI can play a role. We'll see to what extent, the future holds for that. But there are some things that can just be automated, like an automatic DICOM push. Some of these scanners have it where it just happens and it just ends up in Purview, so it's backed up into the cloud. There's going to be some advancements in really in the reconstruction, so you can add image resolution kind of thing. But at the end of the day, I don't see a whole lot of advancement in just the technology of energizing a tube and cone beam. That technology's been around for a really long time. So I think the advancements are going to come in the scanner itself having longevity added to it. So the motor that is behind the gantry that spins that gantry around is going to be improved so it lasts longer. Those kinds of things. It's just easier to use and lasts longer. That's where I think the future is going to be headed for CT.
Great. Yeah, appreciate that. So the next one here, do you only work in the ENT space? And, I'd add to that, why has that been your focus as well?
We are focused in ENT right now. We do a little bit in dental, and when we do dental, it's more of the service side of things. But we are at 99% focused in ENT, and I like that. It gives us this
Yeah,
focus where we know our customer, we know the products that are out there, we know the solutions that are going to work, and now we're experts in ENT. So when our ENT prospects and customers have a question, we have the answer for them. That's what we're here for.
yeah, that's great. And I think that comes back to your comment around empathy as well, right? Being so focused allows you to be really empathetic with your customers because you've been there, you've done that. You know what they're going through.
Absolutely.
And also, from our side, if you don't know the answer, you probably know where to go to get it because you
Absolutely.
got enough people that are also dealing with it.
For
Um,
sure.
no, that's good. So, any other questions or any other things that you'd like to touch on here, Mike, that well, we've still got a couple minutes.
I want to thank you, Josh, for this opportunity to talk about it. And yeah, I'll give you guys some credit that Purview has been an excellent, appreciated partner of ours. Speaking of speed of customer service, when we call you guys, when we have an issue, it's responded to immediately. And I love that. So I want to thank you publicly that you guys have been great. Love the software, love the partnership. So thanks to you guys again.
Great, thank you, and likewise, it's been a great relationship. And like I said, it's been great to see you guys scale and grow over the years. So I think we have some contact information if people want to get through to you. We'll throw that up on the screen here, and I know you've got your email here. So if somebody's interested either in checking in to see if your service really is how fast you say it is, or well, not, I
Please
think
do. No, I
you've got.
like that, Josh. You can call me out on it. So there's an email on there, service@tungstenmed.com. If there's someone out there that you want to test it, send us an email. To have some kind of subject like I don't know, test or something like that. I only say that to say, well, we may spend some time wondering who is this person if
Sure.
if you're like asking some of a fake question about a CT scanner or something like that. But yeah, test me if you want to send it at 1 in the morning. I'll probably be awake. You can test our response time at any time. I encourage you to do so because yeah, I'm saying that we're fast, and so let me prove it to you. So send us an email, service@tungstenmed.com. I'll respond very quickly.
Very good. Well, thanks so much. And if anybody out there is interested or in the ENT space, you've got the contact information there for Mike. Thanks again, Mike, for joining us today, and stay tuned for future upcoming webinars and events, and we'll post those publicly on our website as they become available. So thanks, Mike,
Thanks,
and
Josh.
for all who joined, thank you for your time today.
Take care. See you guys.
Thanks. Bye.